Hello guys, welcome to Main Magic channel. Today let's go into deeper into medical coding, a comprehensive guide to understand medical coding fundamentals, guidelines, and career preparation. Let's go. What is medical coding? Basics. Medical coding is the process of translating medical diagnosis, procedures, services, and equipment into standardized codes. These codes are used for billing, insurance claims, data analysis, and healthcare documentation. Also, simply you can say, for example, if you're going to a hospital, you're meeting a physician, and the physician is caring you, and he tells you having a fever. Further, you need to give a code which is translate. This whole conversation is translated into a single diagnostic code. Key points: ensure accurate billing and reimbursement, standardize the patient's data across the healthcare systems, reduce errors in claims and medical records. Why it is important? Proper coding prevents denied insurance and insurance claims, helps hospitals, clinics, and insurance companies track diseases, trends, and resource usage, play a crucial role in a healthcare companies and reporting. Next, coding guidelines. Coding guidelines are the rules and instructions coders follow to code diagnosis and procedures accurately. They ensure consistency and compliance with the official coding standards. We will be having a coding standards. According to the coding standards, we need to code. And coding for coding guidelines also will be having a different guidelines for the different diseases. Next, purpose of coding guidelines: avoid coding errors, ensure uniformity across hospitals and coders, clarify how to interpret it and assign codes, help in handling the tricky or unusual cases. Next, types of coding guidelines: general guidelines apply to all chapters in ICD, CPT, and HCPCS. These are called as general guidelines. Next, chapter-wise guidelines, like specific rules for each ICD chapter. Like each ICD chapter is having a specific rules, like for example, respiratory, digestive, or circulatory systems, or CPT section like surgery, radiology, medicine, etc. Like you will be having some guidelines in ICD like sepsis, neoplasm, HIV, AIDS, hypertension, diabetes mellitus, etc. Next, applying guidelines while coding. Coding process steps. Always read the main term and subterm in the coding manual. Follow stepwise coding instructions. Primary diagnosis first, then secondary. Use exclude notes, code ranges, and cross references carefully. Confirm laterality, episode of care, and complications if applicable. Next, let's see. Common coding mistakes and how to avoid them. Let's see. Mistake. Using unspecified codes, like how to avoid review document carefully. Use most specific codes. Not following chapter guidelines. Set chapter specific instructions, which is most important. Wrong sequence of codes. Your primary diagnosis first, then secondary. Sorry. Misinterpreting documentation carefully with the physician or a chart notes. You need to see carefully with the physician or a chart note. Next, ICD. ICD stands for International Classification of Diseases. 10th means ICD, managed by WHO, World Health Organization, used to code diagnosis and medical conditions only. Structure, let's see. ICD-10, mostly used globally, has alphanumerical codes. Example, I-10, essential primary hypertension. Organized by the chapters. Example, chapter what we can say 9. Diagnosis coding rules. Always code confirmed diagnosis. Always code only for the confirmed cases, not just symptoms, unless the only symptoms documented. Along with the symptoms, the disease is documented means you need to code only for confirmed diagnosis, unless only symptoms documented. Use specific codes, primary, secondary, rather than unspecified ones. Apply combination codes when possible. Respect, exclude one and exclude two notes. Example case, let's see. Patient diagnosed with the type 2 diabetes with the neuropathy. Type 2 diabetes with the neuropathy. ICD-10 code E11.40. That is diabetes mellitus type 2. With the diabetic neuropathy unspecified. If beside 0 or 9 contains, which is called as unspecified. Here they were telling type 2 diabetes. 11 is type 2 diabetes. 4 is neuropathy. 040 is unspecified neuropathy. They are not specifying the disease. Next. CPT. Current procedural terminology. Maintained by American Medical Association AMA, used for procedure and services coding in the US. And in the month of January, the book will be updated. And here in the month of December, the book will be updated. Sorry. So sections, evaluation management, EM, anesthesia, surgery, radiology, pathology and laboratory, medicine. Next. Evaluation management basics. EM codes represent the patient visits and consultants determined by the level of the history, exam, decision making. Example, 99213. Office visit, established patient, moderate complexity. 2-character codes that give additional info about the procedures. Modify 25, significant separately identifiable EM service by the same physician on the same day as another procedure. Sorry for this. Actually, it is in the month of April, October 1st. The book will be updated. Sorry. Next. HCPCS, Healthcare Common Procedural Coding System. Sorry for repetition. Healthcare Common Procedural Coding System, managed by CMS, Center for Medicare and Medicare Services, covers services, equipment, and supplies, not in CPT. And HCPCS contains 2 levels. Level 1 is CPT codes, physician services and procedures. Level 2 is non-physician services, durable medical equipment, supplies, ambulance, drugs, etc. Use cases. Use HCPCS level 2 codes for items like wheelchairs, prosthetics, or injectable medicines. Important in Medicare and Medicaid billing. Next. Interview questions for medical coding. What are the common questions asked in medical coding? How to answer them? I'll be giving you question and answer, then tips to answer. Let's see. Okay. What is medical coding? Answer is the medical coding is the coding conversion of oral conversation into alphanumerical codes, which is used by ICD-10, CM, CPT, and HCPCS. Difference between ICD, CPT, HCPCS. One small difference you can say, ICD, which is coded for the diseases, CPT is coded for the procedures, and HCPCS is coded for the equipments, durable equipments. Next, how do you handle unspecified diagnosis? I'll be handling unspecified diagnosis by checking the properly, reading the whole document or the chart with the physician, seeing with the specified diagnosis. How do you verify code with documentation? or we'll be reading the whole documentation. We'll be finding a certain scenario or the case of the disease, so we can find a code to them in the documentation. Next, scenario-based questions. Like they'll be asking some scenario-based questions, or you need to search a code, or sometimes they may ask to explain also without searching the codes. Code, like a code a patient to visit with diabetes and hypertension. Next, code a procedure followed by an office visit on same day. Modify application what same day. Next, tips answering confidently. Stick to standard definitions. Mention coding rules or guidelines. Show familiarity with the manuals and coding tools also. Next, preparation tips for medical coding. Before going interview, you need to follow these tips and prepare properly for the interview. Then only you can crack the interview. Study plan for beginners. Learn ICD 10 chapter wise. Practice CPT sections and modifiers weekly. Understand HCPCS level 2 codes for supplies. And one more thing, add you need to learn anatomy physiology also for the coding purpose, like medical terminology also you need to read. Daily coding practices. Pick 2 to 3 world cases scenarios, code primary diagnosis procedures, and use character modifiers. Review your work using official coding manuals or online resource. Online resource AME, APCC, both are providing online resource for ICD. You will be having all coding code lists. Next, tips to crack interview as a fresher. Be confident with the basic definitions, practice scenarios, based coding, show knowledge of documentation, review and compliance. Keep update with the latest coding manuals and guidelines. You need to be updated every year. In the every year, the book and coding guidelines will be changed. Next, resume and interview guidelines. See, highlight any certification like a CCA or CPCA. Mention practical coding practice. Emphasize attention to detail and accuracy. Next, thank you for today. Next